I'm Dr. Kathleen Altimos from the Division of Pediatric Nephrology. We would like to share with you some techniques for obtaining the most accurate blood pressure measurements in our pediatric patients. First, we will start by focusing on the placement of the blood pressure cuff. As you probably already know, obtaining an accurate blood pressure measurement in a child can be very difficult. We have the option of measuring the blood pressure in either the arms or the legs, and sometimes the legs seem like the easiest way to get a good blood pressure reading. We would really encourage you to use the arm every time for every blood pressure measurement. So remember, please use the arms and not the legs for the most accurate blood pressure measurements. To assist with demonstrating correct placement of the blood pressure cuff on the arm, this is one of our colleagues, Dr. Tammy Brady from Johns Hopkins.
Center of that leg.
Here, Dr. Brady is showing us the correct position of the cuff on the upper arm with the bladder centered over the brachial artery. She's ensuring that the cuff is not too tight and that she can fit about 2 fingers underneath the cuff. You also don't want it to be too loose. And you want to ensure that there's enough room in the antecubital fossa for your stethoscope to get that good manual auscultation. However, before we can measure the blood pressure accurately, it's important to know that we've chosen the correct cuff size for the patient's arm. You can do this in a very technical way by finding the mid-arm circumference and then comparing this to the mid-arm circumference ranges on the blood pressure cuff. Dr. Brady will demonstrate obtaining a mid-arm circumference.
Of the shoulder to the tip of the elbow on the dorsal aspect of the arm. And for Chelsea, we have 32 centimeters. So half of that would be 16. And so you'll take your pen and you're going to want to mark where that is. So that you can remember where you need to place the cuff, or the tape measure. So then you'll have her place her arm straight. And now you'll measure the mid-arm circumference. And you want to make sure that this is snug but with no indentation. Okay, and so for Chelsea that's 23 centimeters. Okay, so then you use that information to determine which cuff you're going to use. And so for Chelsea, you'll see here we're going to use a child-sized cuff with her mid-arm circumference being 23 centimeters. Then what you're going to want to do.
There are many different types and brands of pediatric blood pressure cuffs and an array of sizes, and we have different ones in both the in and outpatient setting. However, it's important to know that most blood pressure cuffs have a range for the mid-arm circumference, and that is highlighted here by the circle. And you can use your mid-arm circumference to make sure that it's in the middle of this range and that the blood pressure cuff is an appropriate size for that patient. There is also a quote-unquote quick and dirty way to determine that the blood pressure cuff is the correct size for your patient's arm, and this involves using both the width and the length of the bladder. It's important to know that the bladder is the inflatable portion of the blood pressure cuff, and it is not the entire inside of the whole blood pressure cuff. Dr. Brady will show us the bladder of a blood pressure cuff, which has been removed from the outside of the cuff.
Than the packaging, and I've demonstrated that here with the adult cuff. This is the bladder, and you'll see that it is, in fact, much smaller than the packaging. And what you're going to want to do is
So once you've identified the bladder of the cuff, you want to make sure that the length of the bladder fits 80% of the way around the mid-arm circumference, and that the width of the bladder fits 40% of the way around the patient's mid-arm circumference. And you're going to have to turn the blood pressure cuffs a few different ways in order to determine that. If the cuff is a bit too snug for one size, for either the width or the length of the bladder, then we would recommend just simply sizing up on the cuff. As mentioned before, there are different sizes that are available in both the inpatient and outpatient setting, but they are pretty similar to each other. There really are multiple cuff sizes, and these are similar to what's available in both our in and outpatient settings. I've commonly seen size infant to thigh, or the 7 to 13, available in the inpatient and outpatient settings here at Penn State. There are a range of mid-arm circumferences for each of these, and so those ranges can be used, and we can also size the cuff using the 80-40% rule as previously described. We'd like to note that using the long sized cuff is not the same as sizing up. For example, from large adult to large adult long is not the same as going from large adult to thigh. And it's also important to note that it's important to use the arm circumference and patient's arm size instead of the weight, which might be indicated on the packaging, which might lead us to undersize the blood pressure cuff for a patient. Sizing the blood pressure cuff accurately in an overweight or obese patient can be difficult because they can have a more conical or truncal shaped arm, but it's important to do the best you can and use the mid-arm as best you can. We'd also like to emphasize that sometimes bigger isn't always better, but in the case of blood pressure cuffs, bigger is actually more likely to give an accurate measurement than a smaller cuff. A smaller cuff will overestimate the blood pressure and make it look falsely higher than it actually is. It might lead to inaccurate diagnosis of hypertension or treatment of hypertension that is not needed and could potentially be dangerous for the patient. So when in doubt, please always size up on your cuff. To summarize our main points from this video, please use arms and not legs for blood pressure measurements. Be sure to use multiple techniques to choose the appropriate size cuff, and don't hesitate to upsize the cuff, as bigger is usually better. Thank you for listening, and thank you so much for helping us to take the best possible care of our pediatric patients.